Emma, you work for Life for a Child. You received 100,000 euros from Medtronic last year as a result of this Blue Balloon Challenge because so many people participated. And we are again doing this fundraiser. Medtronic is doing the fundraiser. We are helping with the awareness and the engagement around this. But it is now time for you to introduce Life for a Child as an organization for those of you who don't know your work yet. And yes, please just take it away. Tell us how you're working and also what impact last year's donation had on your work.
Thank you. Really appreciate the opportunity to do this. Are my slides available? Yeah, there they are. So it is so wonderful to spend, I think it's now my third doc day with this community. And, you know, getting towards the end of doc day just now, I feel really emotional having listened to all of you, but I also just feel incredibly lucky. And I really speak on behalf of Life for a Child, as we all, our whole team, feel so lucky to be able to share with you a little bit more about our mission to help all young people in under-resourced settings living with type 1. And I have to say this, but on a personal level, this doc day is really special for me, and it's almost kind of surreal for me, you know, really seeing firsthand how the dedoc community has grown. And it's kind of a funny story, but it's hardly surprising to see just how small our world really is. Just today, when I was reviewing the agenda for Doc Day, I saw the name of a new dedoc voice, and her name is Laura Pavlakovich from You're Just My Type. And I literally couldn't believe I was reading her name. Laura and I met at diabetes camp almost 25 years ago, and we grew up together. She was my best friend at camp, and it really feels like kismet to share this space with her and with all of you. And I think it's just another reminder from the diabetes universe that the community is a forever kind of thing. So as Bastian introduced, I'm Emma Clateman. I'm Life for a Child's Global Advocacy and Policy Lead, and I want to take my time with you all today just to tell you a bit about how the Blue Balloon Challenge impacts Life for a Child. But first, I just wanted to share with you all a selection of entries from Life for a Child's most recent art competition. You know, where you live in the world with type 1 diabetes can have a huge impact on how you live with type 1 diabetes. But, and that goes without saying, but these entries from Sri Lanka, from Bolivia, and from Mexico break down those differences, to me at least, in some ways, because I can relate to each of these, and I'm sure you all can too. I relate to the hope, I relate to the darkness, I relate to the exhausting complexity, but I also relate to the choice. So while there is relatability in what I was just saying, at least for me there, the experience and life of having type 1 diabetes in a low or middle income country can stand just straight in the way of hope and choice. And that's because basic supplies are really insufficiently provided by health systems in these settings. And so while the ingredients to diabetes management for T1D can look very similar for everyone affected globally, no matter their location, for me, it's really important to realize that type 1 diabetes is not the great equalizer. But this is where Life for a Child steps in, and we've been going strong since the early 2000s, and we've been steadily expanding ever since. And through connections with health centers, local health centers, we're now supporting over 34,000 young people in 44 countries. Our expansion is keeping on, it's growing, and in 10 years, we aim to support over 150,000 young people living with diabetes in 65 countries. And just a little bit about how Life for a Child works is the way that we work is through increasing the capacity of existing local health centers looking after young people and their families with type 1 mostly. We focus on direct support of diabetes supplies, including provision of insulin, blood glucose monitoring supplies, syringes and pens. Also, co-developing and collaborating on education for healthcare professionals and families. And also, we do a lot in the way of the promotion of sustainability through research and other forms of advocacy. And as Bastian and Mirai were saying, last year was a huge year for us. But it was a huge year for us for a couple of reasons. We launched our expansion, our 10-year program expansion. But it was also huge because it was the first year that the Blue Balloon Challenge fundraised and created such awareness for us. And just to share on the ways in which last year's impacts helped us, they helped us enormously to ensure that we are able to do what we do for years to come. The campaign really helped us to secure funding for direct support of the program and also ensured we can continue to encourage sustainability through those evidence-based approaches around research and also evidence-informed advocacy. And this slide just gives a little insight as to the direct support our whole program was able to achieve in 2021 in the last year. And just to touch on the impact in a bit more detail, is that the funds from the Blue Balloon Challenge, help us to provide really essential equipment like HbA1c machines to diabetes clinics across the world in need. I think this will come as a surprise to you, maybe not, but in many low and middle income countries, clinics are not supported with HbA1c testing supplies in a lot of settings by their health systems. And as a result, young people have to pay out of pocket to get these tests done. And when Life for a Child is able to provide these machines to supported centers, young people can get access to this crucial component of care without incurring catastrophic costs. And further funds from the Blue Balloon Challenge allow us to keep collaborating with local healthcare professionals to develop impactful education resources that help families. And the awareness created from the Blue Balloon Challenge has been so important to Life for a Child, and I can't wait for more people to get connected with us and see what we do and have more conversations. I've seen firsthand the ways in which program support, be they supplies, education, or advocacy, helps give families and their type 1s choice and hope and safety. So really, thank you from the bottom of our hearts at Life for a Child. Thank you to this beautiful community and to dedoc and Medtronic for helping us reach those in need. Thank you.
Thank you, Emma, for presenting Life for a Child and the important work you do. We know that we've had Lily joining us earlier, and their support to you has been more than a decade long, and they have really helped you start this expansion. But I think it is so great that also the community, while they don't chip in by donating themselves, they can through Spare a Rose, for example. They did that for many years. People can donate directly, but also awareness campaigns like this, I think, are so amazing because, as you were just saying, it is sometimes, yes, of course, it's also going to be the funding coming through the Blue Balloon Challenge now, but it's also raising awareness for the work that you do. And that's why we've had you on Doc Day for a number of times now. We've had you at our symposium last year because we think it is important that more and more people know about the amazing work that Life for a Child has been doing for over a decade now. So thank you for being here, talking about that again. And we, the community, we will do our best now with the Blue Balloon Challenge to support your work as best as we can.
Thank you to everybody. Thank you so much.